Hi everyone, I hope you all are doing well. My name is Grace, and in this video, we will be understanding how to deal with the chest symptoms that come in anxiety. Cardiophobia, this morbid fear that something is seriously wrong with your heart, and all the doctors have missed identifying what the problem is. Let's get started. Thank you for being here, and do consider subscribing to my channel. So, usually for most people, cardiophobia or chest anxiety begins with that first episode of intense palpitations or the first panic attack or anxiety attack, where you feel that your heart rate has gone so high and the palpitations are so intense that it's not possible to just ignore it and let it be. This makes you go to the doctor or to the emergency ward or to the A&E, whatever it's called, where you are living, and you tell them your symptoms, and the first thing they decide to do is get a ECG, an electrocardiogram. Usually the ECG will indicate that everything is okay. At max it may pick up something known as sinus tachycardia, which is medically just the term for a high heart rate. Sometimes there may be some minor changes seen in the ECG which are seen in a person who is having a high heart rate or tachycardia. Now, just to be doubly sure, the doctor may decide to do a stress test or, in some cases, even a 2D echo, and usually all of that is fine. And the doctor tells you that, listen, everything is okay with your heart, you're fine, just ignore the palpitations, it was probably just stress. And they give you something to calm yourself down. They may also give you something like a beta blocker, which reduces the incidence of a high heart rate, and you're sent off on your way, and you are so relieved and thankful that wow, everything's okay with my heart, and it was not any of those things, it was not a heart attack or any of those things which you were probably fearing. And then what happens is, when you're on your way back home or after you've reached home, as soon as you leave from the clinic, while you're relieved, but you also notice that the chest uneasiness is still there, it has not completely gone. Sometimes you may see that there is a slight pulling sensation or this constant movement in the heart. Sometimes the palpitations may also come back, and then you are convinced that something is indeed wrong with your heart. The doctor has missed it. Then you decide to either go back to the doctor or go to another doctor, or you may just decide to not do anything, but your mind keeps going back to the chest and you're constantly in fear. This may lead to a lot of other behaviors, like you are always checking your pulse rate, you are hyper aware about your chest, any slight movement in the chest or any slight change in your breath where you feel that your breathing has suddenly become heavy, you become very, very aware and very, very scared. Also, you start checking your blood pressure frequently, you're constantly monitoring your pulse, or if you have to climb stairs, or if you have to run, or if you have to walk briskly, you are afraid and you do everything to avoid that. If you have to travel, then you would also want to avoid that, because you think that, no, what if there's no hospital close by? What if something happens to me and they need to rush me to a hospital? It will be silly if I go to a place where there is no emergency help. You may also notice that your chest related anxiety is worse on holidays or on Sundays, because you know that the doctors are not available on Sundays. And all of this just starts affecting the quality of your life, because the doctors tell you that, listen, nothing is wrong with your heart, but you cannot ignore the physical symptoms that your chest and your body is giving you. If all of this describes what you are going through, firstly, I want you to know that you are not alone. You are not imagining things. These things are very much happening with you. Your body is manifesting these symptoms. And I know it can be very terrifying. I have gone through it myself, so I absolutely understand. No matter how your fitness level would have been before this started, it can be very terrifying. And yes, there is a way to manage this. One disclaimer, the solutions that I'm talking about, everything that I'm talking about in this video is only for those people who have chest symptoms related to anxiety. I'm presuming that you have got yourself checked by your doctor and you have been given the all clean chit and been told that your heart is healthy and you don't need to worry about that. So let's get started and let's look at solutions. First thing I want you to do is, I'm sure you may have gone to the doctor and got yourself checked, but my recommendation is, if you have not gone to a cardiologist, go to a cardiologist and get yourself checked. The thing is that you are not convinced that everything is okay with your heart. You need convincing. So, all of this is only to make sure that you are a little bit more reassured that everything is okay. So, it's better to get yourself checked by a cardiologist if you have not already done so. Now, why will you go to a cardiologist? A cardiologist, this is something specific to them, right? This is their area of expertise. So, you want to go to them. And when you go to the cardiologist, you need to make sure that you tell the doctor that you have anxiety related to the chest. If you're just going to go there and tell them that, listen, these are my symptoms, I have chest pain, I have breathlessness sometimes, I have a fluttering feeling, or I feel that my heart is skipping a beat, whatever it is. If you're just going to tell them the symptoms and not tell them that, listen, I'm losing sleep because of this, because I'm terribly anxious, I feel that the doctors have missed something to do with my heart. If you're not going to communicate this very clearly to them, it's not going to help. Cardiologists would, on a regular basis, meet patients who are experiencing anxiety related to the heart, but they are not going to presume that everybody is anxious and has heart related anxiety. So, it's important that you tell them very clearly. Now, how this will help? If you go to the doctor and you tell them that, listen, doc, I'm here because I'm very anxious, and while I have been checked before, I need some more assurance from you that everything is okay. My doctor didn't do a stress test. Do you think that we could probably do a stress test? Or my doctor didn't do a 2D echo. Do you think you would want to do that? Is there some other test that you think we should also do? Because what happens is, once we get heart anxiety, or for that matter any anxiety symptoms, physical symptoms, we tend to Google, and then we know so much about it, but we have half the information. So we know all the possible tests that need to be done, and then we think, oh, but my doctor has not done this, my doctor has not done that, maybe that is why they have not found out what is wrong with my heart. So you want to just go and ask the doctor and discuss, have a frank chat with the doctor, make a note of all your symptoms, and then go and tell them that this is what I'm experiencing. Now, because you have anxiety, the doctor may just decide as an exception to get all the tests done so that you are relieved. So, usually, in a certain patient with some symptoms, he may have just clinically examined them or stopped after an ECG. But in your case, where you are having such high levels of heart related anxiety, he may decide to do all the other tests so that you are then relieved that, listen, my heart has been checked in every possible way. There's nothing that's wrong with it, nothing has been missed. So that's why it's important to tell your doctor that, yes, I'm having very high anxiety related to the heart. Also, you could tell your doctor that, is there something you can tell me, doc, that will help me to calm myself the next time my chest symptoms come? So maybe the doctor can spend a little more time explaining to you why you are not a candidate for heart related diseases. He can tell you that, listen, he could spend some more time explaining to you that your ECG is fine and your stress test is okay, and your 2D echo is okay, and your blood parameters, your cholesterol levels, all of that is fine. Probably you don't have such a high family history of heart related illnesses. And he could tell you that, listen, in my practice I have seen that somebody with your kind of profile has a very, very low risk of heart related illnesses. Whatever it is, your doctor will decide what to tell you. But if you categorically ask the doctor that, listen, is there something that you can tell me? Is there a way that you can communicate this data to me such that I can reach out to this and remind myself the next time I have chest symptoms that, yes, but my doctor has checked and he has told me such and such a thing, so I don't need to worry. So that's the first thing you need to do. Go to a cardiologist. You probably want to spend some time deciding which cardiologist you will go to. Probably ask for references or go to somebody whom you are more comfortable with after you have checked reviews. Do that, and yes, first go meet a cardiologist. The second step, after you have met the cardiologist, or at max you have got a second opinion also with another cardiologist, then what you're going to do is decide to not meet any other doctor for your chest related symptoms. That is it. You know what, guys? Every time there is a chest related symptom, every time the palpitations come or the chest pain comes, you may think that, oh, this time is different. Oh, what if this time something happens? And you rush to the emergency ward or you go back to the cardiologist. But that's not how it works. Once you have been given a clean sheet by not one but two cardiologists, if need be, then that is it. Then all the work from there has to be done by you. Because otherwise, you can find yourself in an emergency ward every day. You can be strapped to an ECG monitor 24/7, but that's no way to live, right? So once you have met the second doctor, got an opinion, got all your questions answered, you need to decide and make a resolve that that is it. I'm not meeting any other doctor. Does it mean that you are not meeting a cardiologist ever till the end of your life? No. Give yourself a reasonable time. Say that yes, I can get an annual checkup, an annual follow up done with the cardiologist. So it's not that you're deciding that now whenever I have chest pain, I'm not going to go to the cardiologist. No, but at least for the next 1 year, you can decide that listen, I'm not going to rush to an emergency ward. There is a different way of dealing with this. I have been told it's anxiety. Yes, now I will go for my follow up after a year. And if the doctor then decides that any tests need to be repeated, I will get them repeated only then. Otherwise, you're not going to randomly go and get tests done or randomly hop from one doctor to another. That's the second thing. Now, the third thing that you have to do, the third part is exercising. When you are having cardiac anxiety, you are very afraid to exercise. You're afraid to move, you're afraid to run, you're afraid to climb steps because you just don't want to put any pressure on your heart, your poor little heart. You just want to protect it and not give it any strain. What has happened is that you've just become afraid. You have lost confidence in the health of your heart and in the health of your body. You think that from that moment where you had your first panic attack or your first episode of palpitations, everything just changes. And no matter how healthy you were before that, you may have had a sedentary lifestyle or you may have been a regular gym goer. That doesn't matter. But suddenly, from your first palpitations or your panic episode, after that, you just become so terrified of movement, you become terrified of straining your heart. And now, whatever you are going to do, whatever exercise you're going to do, is just in order to bring back the confidence in your body. So, movement is what we are going to start with. How are we going to start? We're going to start with just walking for a few minutes at a very gentle pace. Depending on how bad your cardiac anxiety is, start at the pace that you are comfortable with. It would be ideal if you're able to go outside, especially get the morning sun and walk outside, just outside. And you can start with as little as 5 minutes at a very slow pace. If you're not able to go outside and you are too scared, because I know some of you may be at that stage as well, just get up and walk around in your house. Just walk around in your house. Time yourself. Use a timer and walk around. Gradually, you will start increasing the pace and you will start increasing the duration. So if you've started with 5 minutes, gradually move to 7 minutes, 8 minutes, 9 minutes, and start increasing the pace of walking. From walking, then you can move to brisk walking, you can move to spot jogging, you can move to running. But first, just start with basic movement. The thing is that once you start exercising, you will notice that every day is not going to be the same, because while you start exercising, the anxiety is still there with you, right? And you are still afraid. And some days may be better than others, but some days your other symptoms may also be very high. So, for instance, when you're walking, you may notice that, today you're getting a little breathless. Or you start walking and you notice that, oh, the chest pain has come and you get very afraid. But my advice to you would be don't stop. If you've decided for 5 minutes, reduce the pace but continue walking. At a gentle pace but continue walking. Don't miss a day. If it's 5 minutes of just walking every day, don't miss a day and just keep at it. Yes, you may have to increase or reduce the intensity of the movement that you're doing. Some days you may wake up feeling great with no symptoms of anxiety, and there's no muscle tension, there's no pain, and you're feeling great, you feel you can do a lot. And you may think that, wow, now the journey of recovery has started and it's going to be like this. But that's not how it always is. Some days are great, some days are not. Some days you may have one good day and the next day you feel, what has happened to me? Yesterday I was fine. So just let things be. On some days you may also have other symptoms of anxiety, because anxiety does tend to produce things like nausea or dizziness or a lot of muscle fatigue. And on those days where the other symptoms are also high, you may find it challenging to continue exercising at a high intensity. So take a step back. But my I would highly recommend that don't stop, don't skip a day. Continue with the movement, and gradually you'll see that as you're exercising, you are building that confidence back in your body. Also, remember that when you are exercising, you are releasing endorphins, and that is what helps to elevate your mood and thereby also reduce anxiety. The fourth step is start maintaining a cardiac journal. Now, what is this cardiac journal? I'll tell you. You can use a notebook to make a note of these things, or you can just use, your phone or your computer to make a note of these things. I suggest you do it in your phone. It's just easier because the phone is more handy. What you have to do is you need to start making a note from the day you start exercising, okay? And if you have cardiac anxiety and you've been told by your doctor that, listen, everything is fine, you're okay, it's just anxiety, your heart is fine, and you haven't started exercising, then please start today itself. Start the movement today and start maintaining the cardiac journal from today. What is this cardiac journal? There are two things you will make a note of. You need to make a note of the date and two columns. One, you will note down how much movement you have done for the day. So let's say in the morning you walked for 5 minutes. Great. Make a note, walked for 5 minutes at a moderate pace. If you were able to do brisk walking for 10 minutes, whatever it was, if you did some stretching, if you did some light weights, maybe whatever it was, okay, because as everybody is going to be on a different journey. And on the right side, whenever you get a symptom in your body related to the chest, just make a note of that symptom. So let's say you have some palpitations, make a note, had palpitations, lasted for so many seconds or minutes, whatever it was, or had this kind of a sensation in the chest, had some pulling sensation, had some pain in the left arm, whatever it was. So every day, when you notice that you're having a physical symptom of the chest anxiety, you will make a note of it on one side, and you will every day make a note of the movement that you have done on that side. And gradually, the aim would be that don't miss a single day of movement, and every day aim to increase the movement a little bit. So let's say if you start with movement only in the first half of the day, morning for 5 minutes, gradually aim to do some movement in the evening as well. Now, how is this going to help? Well, firstly, you will go back to this from time to time, and you will notice that these symptoms have been lingering for some time, okay? The chest symptoms, you'll notice that I have mentioned pain in the center of the chest, which I have mentioned it's been there a week ago, then it came back, today it's there, and then you'll gradually notice that it's been 15 days, it's been 20 days, and these same symptoms keep coming back and going. That means these are just chronic symptoms, it's just related to anxiety. And what happens is, we have a couple of good days where we don't have symptoms, and then when the symptom comes back, we tend to forget that, listen, these symptoms have been there since a long time. Some of us have been suffering from this since maybe months or even years. Yet we respond with fear every time this symptom comes. And chest and heart related issues are usually more acute if they are serious. It can't be that there's something seriously wrong with your heart, but since 2 years you've been managing your life okay, you've done everything. Or even if you consider the past 15 days, you've done things, and every time you thought that this is it, this is the final time, I'm getting a heart attack. But life went on, the pain subsided, and you went on. So you're going to keep going back to these symptoms, read them, and kind of assure yourself that this is just anxiety. This is just the high stress hormones which are causing the symptoms. This is just the muscle pain, the muscle spasm which is causing these chest symptoms, and everything is okay with my heart. Also, you're going to note the movement you've done, right? So you will go back to the movement and say, wow, I have been walking since so many days. The other day I did brisk walking, I did jumping jacks, I climbed stairs, I ran behind my kids. I did so many things, and if at all anything had been wrong with my heart, indeed, I wouldn't have survived. Something would have happened. So it's just a way to remind yourself that, of course, this is not something serious. My heart is healthy. Of course, this is just anxiety. I suggest that when you start making this cardiac journal or this cardiac log, you make a note of it for at least 2 months, and then you can stop after that. because 2 months is a good enough time, first of all, for your exercise to build a decent momentum. 2 months of constantly doing some movement every day, you would have built up a good momentum. Also, within 2 months, you would have experienced most of the chest related symptoms that you usually experience, be it tingling in your hands or just some breathlessness or some pain or whatever it is. So, palpitations would come and go, and you will notice that, yes, this is a pattern, and eventually you will stop giving it that much importance, which is why I think it's very important to make a note of it. Memory can be so strange that we forget every time a symptom comes. We feel that, oh, I have never experienced this kind of a particular pain, this pain is different. But if you make a note of it in your log in your phone, and then you go back, you will realize, of course, this has happened before. What am I talking? I'm just forgetting that this has happened before, and I'm going to let it go. I'm not going to give it importance. I'm not going to go on to Google and search that, what does this symptom mean, or I'm not going to call my doctor and take an appointment. I'm going to let this be. I'm going to just let the symptoms pass and let my body heal, let the anxiety take care of itself. So the fourth thing I want you to do is start maintaining a cardiac log. Now, the last thing that I want to tell you is that once you are on this journey and you start making these changes, give your body time, because once you have anxiety, and now the anxiety is so much that the body is producing symptoms, it needs time for your body and your brain to get retrained. First, the brain will get retrained, then the body will also start catching up. Remember, when you got anxious at first, immediately the palpitations didn't start. Your body was doing its thing, right? It was trying to maintain balance. It didn't throw up all these symptoms at the first go. But because it has been bombarded with too much stress chronically, and probably other things like not enough sleep, poor hydration, poor nutrition, everything together, it has reached this stage where it is now not understanding whether there is an actual threat in your surrounding or there is just a perceived threat. So it's an alarm system which is not functioning properly. And for this alarm system to start functioning properly again, you need to give your body some time. So you may notice that you are doing everything right, but the chest symptoms are still coming. Or you may have a great phase where there are no symptoms and then suddenly it comes back, and you may think, now what happened? So don't let that pull you down. Be prepared that there are going to be ups and downs. The body is going to take time to heal. Once you're on your path, stick to it, do everything, and just know that it is going to get retrained. The brain is going to get retrained, the body is going to get retrained. You have to keep sending it messages of safety every time that you are going to be now in a stressful period, and you will be, right? Life is going to throw stresses at you. That's life. Now you will choose to respond differently than what you used to respond, how you used to respond before these symptoms started. You can choose to respond more mindfully. You can choose to not ruminate too much on events that have happened which have made you unhappy or stressful. You continue doing all of these things and give your brain and give your body time. Give the chest symptoms time. Don't go back into that loop of again checking your symptoms or being very desperate that it's been 15 days, it's been 2 months, it's been 6 months, and this thing is not going. Give it time, it will start reducing. Maybe you may have a flare up, or you may have one episode in between where things get worse, and that's normal, that's expected. I have also experienced the same thing. But every time this happens, just keep reminding yourself that you have been checked out. The doctor has said everything is okay. You have been exercising. You have been taking care of your body. You have been experiencing these symptoms before and nothing has happened. If that time nothing happened, what makes you think that it's going to be different this time? And just keep your mental talk in a way that you are relaxing and calming yourself down and not adding second fear. I hope this video has been helpful to you. It has given you some guidelines on how to deal with your chest related anxiety. If you have any specific questions, please leave it in the comments. If you have liked this video, please give it a thumbs up and share it with anyone you think is dealing with these issues. Take care of yourself, and I'll see you soon in the next video.